Assalamu alaikum dear doctors. In this video I am discussing about long QT syndrome. So long QT syndrome LQTS is a heart signaling disorder that can cause fast chaotic heartbeats, arrhythmias. A heart signaling disorder is also called a heart conduction disorder. Some people are born with altered DNA that causes long QT syndrome, congenital long QT syndrome. Now, what are the features of presentation of long QT syndrome? There is syncope, that is loss of consciousness or near syncope spells, that is triggered by number 1 physical exertion, number 2 auditory stimuli, example fire alarm, number 3 any emotional stress or distress. Repetitive events more concerning. Excluding the events that are likely due to vasovagal events is difficult but necessary. Example, those occurring during abrupt postural changes, exposure to heat and dehydrations, emotional reactions to events such as blood draw, etc. Family history of unexplained sudden death is otherwise healthy persons at a young age less than 40 years. Attention to unexplained death during swimming, death during seizures, a family history of seizure disorder and other unexplained deaths. Sodium channel abnormalities may be precipitated by fever. The cardiac events may appear seizure-like and may be mislabeled as epilepsy. Corrected QT intervals of men is more than 450 ms and women's is more than 470 ms. Look the image of the ECG, that is they compare between the normal QT interval and long QT interval. So look, long QT interval is long. There are some question come on AKP exam that young girl 3 episodes of fell down in bathroom unconscious without jerky movements. The ECG they give. So that is prolonged QT syndrome. Look, the presentation is 3 episode, that is repeated attack occur and bathroom unconscious. And there the ECG is long QT from beginning of Q till end of T more than 13 small squares. So if we count, we find that QT is more than 13 small squares. So that is long QT syndrome. Another question is that 14-year-old with T is 490 m/s. What is the treatment? The treatment is propranolol. So this is all about long QT syndrome. Please do subscribe and share MRCPCH with Dr. Emma Choudhury. Thank you.